Welcome to the Social Work is Everywhere podcast, where we uncover the powerful, diverse, and far reaching impact of social work across the globe. We are your hosts, Dr. Lynn Michalopoulos,
David Robertson.
through the voices of the University of Maryland School of Social Work community. We'll explore unique perspectives and innovative initiatives shaping the future of the field.
Each episode, we spotlight the practice, research, and experience of students and social workers from clinical care to policy change. Social work is truly everywhere.
Today, I am very excited to have two dear friends and colleagues joining us today to talk about the Moving Well Project mobile application. So we have Sabeen Ahmed and as well as Munsaka Mubela. So if you can just both briefly introduce yourselves and then we can talk about the app. So Sabeen, you want to get started?
Sure. My name is Sabeen, and I'm a licensed clinical social worker. I work in Los Angeles, work at UCLA Health. I am a clinical oncology social worker, so I work with cancer patients, and I've done a lot of work in working with community mental health and men who have been in the criminal justice system. And yeah, that's a little bit about me.
Thank you. Munsaka?
Is it good afternoon or good morning, depending on where one is? Otherwise, my name is Munsaka Mubela. I'm a Zambian, and I work for Truck Drivers Association. Of course, in this aspect, is under the project that is run by MWP, which is partnered with the Truck Drivers Association, or under a small wing of Mobile and Alive Zambia that fosters any healthy activities. Otherwise, I am the coordinator, and I've been with the Truck Drivers Association, or rather the mobile population actually, for the past 15 years, trying to help look at the welfare of the drivers as well as their partners. Briefly, this is the Munsaka you are talking about.
Yes, thank you. Thank you both. So as we get started, just want to share a little bit with our listeners about the history of the Moving Well project, the mobile application. So I've partnered with the International Organization for Migration and the Truck Drivers Association of Zambia and other key partners in Zambia to look at the relationship between trauma, mental health, and HIV risk among long distance truckers in Zambia. So we've done a lot of qualitative work. And from that, I started doing this work in 2013. And I think that's when I met you, Munsaka. And we worked together to do a qualitative study to understand the kind of the stressors that the truckers experienced and how that potentially was related to HIV risk. We then conducted a quantitative study, and we were able to interview truck drivers from Zambia, Zimbabwe, DRC, and I think that's it, and Tanzania as well, and really look at that relationship as well. And so we found that there was a clear relationship between trauma and HIV risk. And so we were interested in and talked to multiple partners to see what can we do to actually kind of reduce the risk and address some of the health and mental health problems within this community. And that was kind of the development of the mobile application. Obviously, working with labor migrants, specifically long distance truckers, you can't do in-person group sessions or individual sessions over a long period of time. And so we really wanted to be able to address the needs through something that was mobile. And so why don't we pause here? Hi, Gracious. Do a brief introduction and then we'll go back and then just kind of your background.
My name is Gracious Witola, and I'm a social scientist. I've been working in public health research for over 5 years. Worked on several studies, stigma studies, mental health. I'm very passionate actually about sexual reproductive health and rights and mental health and stigma. I've also worked on some COVID studies and TB as well. So I think that's what draws me to this study, because I'm so passionate about mental health. And when I was told, oh, there's a mental health study, I was so excited about it because I'm so passionate about it. And, you know, just the fact that men were involved with mental health, like in Africa, coming from an African country, it's something that's kind of like looked down upon. If a man complains about how they're feeling, their emotions and the like. So it was just something interesting to be a part of something like this. Yeah. So yeah, that's that. And yeah,
Thank you.
hoping to continue pursuing my career in this line of mental health and stigma around disease and the like, infectious diseases. Yeah.
Thank you. Thank you. So it would be great to just hear from each of you on kind of your role within the development of the Moving Well Project app. And unfortunately, we weren't able to have folks represented from the actual company that developed the app. But we provided all the content, and they then had consultant for drawing the pictures and doing the voiceovers, but they were essential to this project as well. So their VMO is the name of the organization that provided that for us. So why don't we get started with you, Sabeen, and talk a little bit about how you got involved with this project and your role specifically.
Yeah, so I had worked with Lynn on another project with female fish traders in Zambia, and we had worked on adapting a manual, a curriculum. So I used a lot of that curriculum, and I used that to write up the content for the app itself. So I wrote up about 8 lessons altogether that were to be delivered to the truck drivers via videos over WhatsApp. And they were intended to provide education about mental health, trauma, coping skills, HIV treatment and testing. So my role primarily was to create the content for write up the curriculum, and edit it, and just continuously do that to make it to make sure it's culturally relevant to truck drivers, which we needed the assistance of the local population. The truck drivers itself, of course, couldn't have done that without that.
Right. Yeah, and you the modules that you developed, they're based on kind of like in general evidence-based practices?
Yes, so I used a lot of dialectical behavior therapy, use that model, a lot of CBT. I also use a lot of your research in itself, about especially to direct it specifically to truck drivers to see like what are some of the issues that are coming up in the population. So using that and putting that in little parts of the curriculum, to make it also relevant to the population that it was intended for. So, and we added meditation and mindfulness. So we used that orientation as well. Yeah.
And there was also the like behavioral activation of the find what
Behavioral-
feels good, right?
Yes.
Yeah.
Yes.
Awesome. Thank you. Yeah, it was great being able to work with you, and I mean, you just added so much to the project in and of itself. So it was great working with you on it. Munsaka, can you talk a little bit about your role in the MWP?
Thank you very much. All what I can say is that I think in all areas, I'm a coordinator. I'm coordinating.
Yes.
Yes, in all areas. And what it is that I think the gap was identified by Moving Well project. Was identified that actually there's some certain information that actually is lacking, and let me just say there's a gap among the mobile population. And fortunately, I found myself actually to be among those who do facilitate or rather coordinate. And hence, I just jumped onto this bandwagon to say, how can we help in? And when it came, that was somewhere in 2013 when the mobile Moving Well project started. Of course, it started with the aspect of trauma as well as the mental health. Now, when the app was introduced, it was as a result of those, what happened, the outcome of the research that was conducted somewhere in 2013, 2014. Hence, they discovered actually that there's a gap. And how do they come up with this gap? This gap was supposed to be bridged. The only way to bridge this gap was to find something that would find the drivers, whichever area they are. And hence the app was developed actually with the, of course, it came in as, maybe I would say it was a dream come true by the leaders of, or rather the management from Moving Well project. And that's how now others were co-opted in. Of course, Truck Drivers Association was also co-opted in, and we brought in the VIAM, that is the company that actually developed that. But the nitty-gritties was somehow, first of all, it was developed by the Moving Well project, where actually Sabeen, Dr. Lynn, I think those are the people who really facilitated. Came in as just to say, how do we, in a tailor-made aspect, to say this language can suit the mobile population, something like that. And actually, if I say, it really helped, and at the end of the day, it really had an impact. This is what I can say on aspect of the development of this app by the Moving Well project. We are part and parcel, and will continue being part and parcel of that. Thank you.
Thank you. Thank you. Yeah. And Munsaka, you've been a key part of this project throughout the whole development, but just the folks that you know and have connected to and like brought in to give feedback on this project, everybody from government officials to truck drivers associations, unions, you were very well connected to the community and have been, without your help and facilitation and as you said, coordination, like as a coordinator, it would not have happened. So we are very grateful for you on this work. Gracious, can you talk a little bit about your role in the project?
Thank you, Lynn. Well, for me, actually, my role was like strongly tied to Munsaka because I couldn't work without him.
Yeah.
So Munsaka and I went together to trucking companies, looked at some trackers. So amongst what we're doing was that we're measuring their eligibility, seeing if they're eligible. So were they able to speak English? Did they have a mobile phone? Because they had to, the app was operated on the phone. And it was quite interesting to interact with them. So once they were explained what the study was about, how it was working, and we got their consent. We had we had sessions. So in these sessions, we really just spoke more about what they expected to, what they will find in the app once the app is open and running on their phone. So we would explain to them about things such as trauma, because trauma was one of the modules there. We had mental health. We'll talk about HIV prevention services and the like. And I think that was so interesting to just discuss all these parts, some of the modules that Sabeen mentioned. And yeah, once they understand that, would put the link and install the app on their phone and show them how it works. And yeah, so that was part of my role with Munsaka.
And can you talk a little bit about some of the, I mean, both of you had to, well, all of us had to make quite a few kind of pivots throughout the process.
Yeah.
Originally
Yeah.
we had proposed that we would do an in-person session for like an hour to talk about the app, do like an overview, and then they would take it and run with it. But that didn't work. Can you talk a little bit about some of the challenges and how you were able to address that?
Yeah, sure. So because trackers, as we all know, they are mobile, so they're kind of difficult to find. It was so difficult to get them in one place and just have like a session. So when we went to the different tracking companies, we couldn't meet the numbers we had planned for. So we had to become more creative. We formed WhatsApp groups, and in there we would have like we had them via Zoom calls. Some we used the WhatsApp voices, like just sending voice notes, explaining, and we created these platforms where we would interact. And I think that worked. Actually, the ones that were recruited via platforms were actually more than the ones we had in person. And I thought that, and trackers who have been, introduced on the WhatsApp groups that we had, we formed like 3 different WhatsApp groups. In those groups, they would also invite others, and that worked better, like suggest someone at their company that we didn't meet when we went in person. Yeah, so that really worked.
Yeah.
And I think for future recommendations, when we're having the Moving Well project or something similar to it anyway, it's easier to recruit the trackers online.
Yeah. Yeah, that makes sense.
Yeah.
And I mean, there were still some challenges with that because didn't some truckers feel like, oh, is this a scam? Are you trying to get money? out of
Yeah,
me?
yeah. Actually, that was like a challenge both in person and
Yes.
online.
And okay.
Yeah, because of the link, the way they have to like, install it on their phone. Some thought it's a scam, and because in Zambia we have a lot of messages that we receive of scammers asking you to maybe insert a certain password or a certain link or everything. So they thought maybe we'd get their money. So there were those worries, and some were like maybe they thought we worked with the companies, like the union. They had
Okay.
those challenges of thinking we'd get from their pay, directly from their pay, but we had to, just sensitize them and explain what we were doing. Despite the fears of us assuming we worked with the companies, like with the union, and maybe wanted to get some of their money directly from their pay and the like. But after, just explaining exactly, emphasizing what our study was all about, what we aimed to achieve, we had good responses. But yes, those fears were there.
Mhm. Yeah, yeah. I mean, I think that they said like really the emphasis of context is important and things that are within the environment or culture that you have to be aware of in terms of potential barriers. Sabine, can you talk a little bit about, we developed this manual for the fish traders based on, it was an evidence-based intervention. It's called Living in the Face of Trauma, which is a manualized group sessions that we had used for the template for the fish trader work. But for the truckers, you kind of revised or used that core information to make the modules. Can you talk about some of the challenges that you had with adapting that for like WhatsApp modules?
I think the biggest challenge was trying to keep it short and succinct.
Yeah.
There was so much information to share, in especially in this like psychoeducation to people. So I think that was probably the biggest challenge, was to make sure to still give a message that was important and could reach people, but still be simple and short. And part of it was also making the language really easy to understand. It's so easy to get clinical and have this jargon that's not very simple.
Mhm.
Making it that was also a challenge. Yeah, I think also delivering it over a video, and again, you like with making sure that it was in something that would be, yeah, again, easy to understand for people.
Right. Just straightforward and right. Yeah.
Yeah,
Yeah.
and culturally relevant as well. I think that was also something we wanted to make sure that we were using words and language that would make sense to the population it was intended for. Yeah.
Yeah. That's why I think it was critical to have actual truckers go through and review the information before we actually put it on the app.
That was like such an important part of the process. Yeah.
Mhm. Yeah. Munsaka, can you talk a bit about, one of the most exciting parts of this whole project to me was the dissemination meeting at the end. Can you talk a little bit about, I mean, I was really blown away by the number of different people that were there, that were represented there. Can you talk a bit about all of those, like the kind of key roles of people that you thought were important to be at the dissemination meeting and what kind of feedback we got?
When you have such a big project and you expect actually the stakeholders to be present, and those are the ones that actually didn't say qualifies you or disqualifies you. So in this case, actually, we were qualified because the people that came in, or rather the institutions that were invited that came in, actually, they came in numbers, one, and those are we had the private and the public sector. When I talk of public sector, I'm talking of the government institutions, those that deal with the transportation, as well as on the part of the mobility. They were there and they graced the occasion. Then when you talk of the private sectors, we're talking of the transporters themselves. As the transporters, then we have civil societies. The civil society are the associations, the unions. Those are the ones that actually run the mobile the mobile population aspect. They are the ones actually that they came in numbers and they were really grateful. They were happy with all the outcome that had, especially the presentation that actually, Doctor, you presented. That was very good because it was simple and straightforward, to the point. And they were happy. They were not kept for the whole day, no. But at the end of the day, they all want to be part and parcel of this moving project. And this moving project, I feel it should continue, because what it is that if it has the blessings from the public sector, which is the government, then it is something that has to stay. And you see, with the support from the private sector, like the way Gracious had earlier on alluded to say, the management aspect, they had actually gave us a go ahead that you do what you've come for in the companies. But here comes to the beneficiary who is resistant to say maybe it's a scam. But now when the management, after going through what we had introduced ourselves unto them, they say, you go ahead. So to me, it really made that actually this project is there to stay, because when the management says, yes, let's go ahead with this, the beneficiary is just supposed to be told to say, let's do this, let's do this. I think this is the way to go. In a nutshell, what I'm saying is that the government, it has a will, goodwill from the government, because when you call upon them, they are there to help. When you call upon the private sector, they are there, including the unions as well as the associations that it drives the mobile population. They are there to support. So I think that is the way to go, and it is good. The only challenge that actually that we had, that like the way Gracious had said, was now when you are introducing that to the community, that is where the starting point, that was a problem. Maybe suffice to say what Sabeen had earlier on said, when we were developing the app, putting the language that they would understand. It was really a challenge because it took almost 4 months. Okay, 4 months in just to fine tune that. I still remember actually we started somewhere in February there. Just to put things straight, it was really hard. Then you also bring in the VMO people to come in to say, this is what we have. Can you translate it to the app, the way, the condition the app is supposed to be developed? I think it was really hell. But thank God, at the end of the day, we managed to reach to each and everyone, and the beneficiaries. They really appreciated, like Gracious has earlier on alluded.
Yeah. Yeah. I mean, I get it. You bring up a good point, Munsaka, in terms of the challenges of research versus implementation, and also dissemination, and trying to make things sustainable. So to me, I would love if we could just go to trucking companies and say, hey, here's this app for truckers that they can use. However, we had a really small sample size. And so as a researcher, I think it's important for us to do like a randomized control trials to look at, is this actually effective for reducing mental health problems and reducing HIV? However, that takes a ton of time, like, and not even just if you have the money, but like versus getting the money and then developing the content and then implementing. I mean, Gracious, what are your thoughts in terms of like research from the research point of view versus implementation, and how do we kind of keep the ball rolling? Because when months and months pass, then it's kind of like people forget about it, and then it gets kind of lost in the shuffle.
Yeah, I think I agree with you. I think it would work better if we had something like a randomized control trial where we would see if it really is effective and if it's working, and like where we would follow people at a point in time and just see how it's working. I think that would work. And I think the other thing I appreciated about our study is that it actually took a service to people, like for the trackers, it's actually hard to find them. And the fact that, and they barely have time to go to the health facilities, it's also not only are we like concerned about their mental health and everything, but we're giving them preventive strategies to use. Like we're informing them, giving them information, and that also is kind of like also a prevention in its own. Like if you have the information about something, like how you will not get HIV, what are the preventive mechanisms. So it also plays a role in reducing. And I think I also agree with Munsaka. We need to. It'd be great to have like an intervention study, but something that is monitored where we could see like, okay, is it effective really? How is our intervention effective? And yeah, I know you said it takes time and a lot of work, but I think it's a work worth it.
Yeah.
Because I also answered some questions, you made us test run and everything. And I really learned a lot from it, and I think it would be very effective given the type of population we're dealing with. A mobile
Yeah.
app is the best app. Yeah.
Yeah.
So I think
Yeah,
it's good.
I'm hopeful for it, and thinking about time, like even
Yeah.
that we're currently doing a project looking at, with climate change and mental health among truckers and other mobile populations. And I feel like it's gracious, you've been running around for months and months and months, like trying to get getting the
Yeah.
approvals. And so it does take time, but that's the kind of it's the hard balance between research and actual implementation and how do you make programs like sustainable.
Yeah.
As we're kind of winding up, I want to just hear from each of you kind of your hopes for what this could look like in the future and how you would like to be involved. Hopefully you would like to be involved. But Sabine, you want to get us started?
Sure. I love what Gracious just said. I think it's amazing that we were able to take this to the population. I think that was one of the things that drew me to it most, that we were making something easy to access for a hard to reach population. That's, such a social work principle, and
Thank you for tying in social work.
Yeah.
make these services equitable. So I would love to see this taken to other parts of Zambia, of Africa, of just the world, because truck drivers
Yeah.
around the world, they deal with this. I'm from Pakistan originally, and the migrant populations have similar issues. So I think it would be amazing to take this to other places. And it's an easy to access intervention. It's over the phone. Everyone has a phone now. Everyone has WhatsApp.
Right.
And so it would be amazing to keep doing this. I would love to be a part of it in any capacity, and maybe make like reiterations almost to see what we could add, if it's possible. And but right now it stands at like a good length, and that's what we wanted, to make it succinct and easy, and want to sustain the attention of the population. But yeah, I would love to be part of it.
Awesome. Thank you. Well, I would love for you to be. So, and Gracious?
Yeah, I think my answer is similar to that of Sabine. I think I would also like to be a part of it in any way. And I think what I wish to see or hope to see is it scaling up. Like scaling up to other countries. It'll be interesting to see, because trackers are always moving from one country to the other, and the like. It'll be interesting to see like a study in different countries, just to see what we get off that. And yeah, and now we have like more information. We have a bit of ways we can navigate about it, navigate recruitment and the like. So it will be interesting to see what really happens. And yeah, I think it's a good study. We need to advocate for it to be scaled up, and
Yeah.
just make more.
Yeah.
Yeah.
I agree.
Mm.
Munsaka, you take us home.
Yes, thank you. And now that we know how to handle these challenges, it is imperative to say, can it spread throughout Zambia? We even sip it over unto all the countries, like the way the rest of my colleagues have earlier on alluded. Let us have that. Then when we have that, of course, the limit is maybe it's financial. But at the end of the day, the people that we are dealing with, for example, in the drivers, it was just limited, like the past one, it was just limited to the Zambians. But you should know that you should also appreciate to say Zambians, they don't work in isolation. No, there are other drivers that are coming from different areas that had actually an interest on the same, like, for example, in their times when they sit, they analyze, I'm trying to answer, I'm trying to go through this app, what is on my phone. So others from different countries, they're also interested to see what is going on there. On that, they are not privileged. To me, it would better. They spread, it is scaled, like the way Gracious has said. Why? Because the road that a Zambian driver uses is the same route that actually a Malawian or a South African use. Okay, the borders that we cross over as Zambians, it's the same borders actually. The Botswanan people come to cross over. The community that they mingle with in South Africa by the South Africans are the same ones that the Zambian truckers mingle with. So it will be very good to say, let's spread this so that each and everyone is able to understand, each and everyone is able to be sensitized, like the way Greta says that actually is part of the sensitization strategy. When you look at the way when I joined, actually, every year I think we used to experience more than 20 drivers dying while driving. I tell you that actually, with that introduction, as of last year, we had only one who died. So meaning that actually others, they are appreciating. By the way, this year, none has died on the wheels. No. So these people, there's what we call a white line. A white line in this transport sector, actually, or rather in the transport sector, it simply means that actually each and every driver should have the information. If the information, something happens in Kasumbalesa, when something happens there, you find that within a span of time of 2, 3, 4 minutes, someone in Kagungula or Chirondo would have that information. So this is the information that we want actually each and everyone should have this. And what is take home? The take home is that let's scale up this program. If possible, let's scale it up. I repeat, let's scale it unto others, because now it will not be very difficult to reach out. Like the way Gracious has said that actually the only way and fastest way to catch the drivers, it is through the same app. Because at times in the tracking companies, you find that there's that bureaucracy, one, and two, at times they'll say, no, the drivers are not there. You should do wait for them to come. But when you say, let's spread it through WhatsApp, because everyone, like Sabina said, everyone has a smartphone now.
Right.
So it will go viral actually, and that is our interest, that actually this program goes viral, and everyone will have the information on the preventive measures. Even others, those who have the fear of the unknown to go for testing on HIV, they'll be able to do that. Why? Because they've been there, they've been taught, and they've been given what we've dispelled the myths. Yes, and the myths that surrounds the HIV and AIDS. I think this is my take.
Yeah. Thank you. Well, thank you, each of you, for the time that you've taken. Thank you for your involvement in this project and this work. I love working with each of you and want to continue. We'll continue to work with each of you. And we really appreciate you being on the podcast. And for those that are out there, we talk about the importance of scaling up and research. So if you donate, then maybe we could do more of this work. Thank you.
Thank you for having us. And we also love working with you.
Love working with you. You are amazing.
Thank you for listening to the Social Work Everywhere podcast. If you've been inspired by the stories and impact shared today, please consider supporting the University of Maryland School of Social Work. Your donation will help fund scholarships, research, innovative teaching, and community partnerships that really make a difference.
Every gift matters. Visit ssw.umaryland.edu/give to donate today. Please choose other and specify global.
And to request more information about admissions to the University of Maryland School of Social Work, please visit ssw.umaryland.edu/MSW. Thank you. Bye for now.